Good morning, everybody. Can you hear me okay? Thank you for coming out for the opening of East Liverpool City Hospital's East Palestine Clinic. I'm Krista McFadden. I'm the CEO of East Liverpool City Hospital. Joining us today to speak on behalf of the clinic is Dr. Gretchen Nickel from East Liverpool City Hospital, Dr. Bruce Vanderhoff from the Ohio Department of Health, and Ohio Governor Mike DeWine. Governor.
Thank you very much. Well, good morning, everybody. Beautiful day. Hope everybody had a nice Easter. This is, I think, a very a good day. Good day for East Palestine. Good day for the area. As you know, that shortly after the train derailment, Ohio Department of Health, the County Department of Health worked together to set up a temporary clinic. It became clear, I think, after a little while, that really what we needed was a permanent clinic. It's appropriate that this site is the site that was picked. It's my understanding Dr. Korn was here for many, many years, and so I would hope that people would feel comfortable being back in this facility. It is East Liverpool Hospital. We appreciate the partnership with them. The health department, the state health department, is working with them to get this rolling, and we just appreciate East Liverpool setting this up. So it's, I guess, officially the East Liverpool East Palestine Clinic. Several objectives here. One, the fire chief has told me, one of the things he told me in my last visit here was that we had approximately 300 first responders. And it really, all of them need to have a baseline established. I know that many of them have already done that, but this clinic will present an opportunity for the rest of them to do that if they want to come here. Second, though, we have just the day-to-day needs of the community. One of the things that we find in different parts of the state of Ohio is a need for primary care physician, and so this will really provide this service to the community to add to what is already here. I think it's significant that this is really a comprehensive clinic where people can come to seek treatment, obtain lab testing, prescriptions, consultation with specialists when that is needed. Let me just, before I stop, I want to thank the First Church of Christ that allowed us to establish a temporary clinic there. We appreciate all of the congregation, and we appreciate their help in regard to that. So I think this is, it's a good day. It's a day where we're seeing progress made in East Palestine, and very, very happy about that. Let me now turn it over to Dr. Nickel and then Dr. Vanderhoff.
Thank you. So I want to tell you about this clinic. It will be a primary care clinic, and as such will provide the entire scope of primary care. We will treat newborns until up to the oldest members of our community. So we'll be focusing on health maintenance, preventive care, and as well as the treatment of ongoing chronic illnesses. We will also be able to provide screening tests as it relates to the train derailment. These tests will be based on recommendations from the Ohio Department of Health, along with collaboration from their specialists. We do also recognize that mental health is an important part of primary care, and we're working with mental health professionals to provide that care at this clinic as well. Additionally, we want to fill the need that's here. So that may mean bringing in certain specialists to the clinic This may include ear, nose, and throat and dermatology. And then when a patient would need a referral to another specialist, we will help facilitate that to get them to the specialist that they need. Dr. Vanderhoff?
Dr. Vanderhoff?
Well, thank you. You know, this is really a remarkable achievement. Under normal circumstances, it can take many months to stand up. It can take many months to stand up a primary care practice. And what we see here is the result of a lot of community collaboration and collaboration, of course, with the state. We've been able to stand up a new primary care clinic in this community very, very quickly. And it's a clinic that, as Dr. Nickel indicated, will not only be able to meet the needs on an ongoing basis of people from the very earliest part of life until late in life, but in addition, we'll also be able to continue to provide a medical presence for support related to people's concerns about the train derailment and the events that occurred in February. Now, it's important to recognize that all of this began with a vision, and that vision was Governor DeWine's. Governor DeWine had the foresight to recognize many weeks ago that we needed to have a strong medical presence here in this community. And so the initial assessment clinic that he referenced, that thankfully we were able to bring to this community in February, as a result of partnerships with the church, the First Church of Christ, who were so generous with making their facility available to us, work with the Columbiana County Local Health District that was able to be with us right from the very beginning. Many people from the Ohio Department of Health, and of course, the East Liverpool Hospital and the physicians, especially Dr. Nickel, who came there. All of that, though, stemmed from Governor DeWine's recognition that we needed that kind of response. And now today, we're here with a legacy, a primary care practice that will be here for this community for many years to come, and is a palpable demonstration of not only East Liverpool Hospital and the Columbiana County Health District's commitment to this community, but the state of Ohio, Governor DeWine, and the Ohio Department of Health, our ongoing commitment to supporting and caring for this community. So with that, I'll turn it back.
Ribbon cutting, I guess.
Ribbon cutting?
All right.
Dr. Vanderhoff,
Come on,
the other
friend.
side here.
Yeah, come on up. Yeah.
Sorry.
Back to the mic. Anybody?
Governor DeWine, we obviously, we've seen the past clinic at the First Church of Christ, but we have to, there's been a loss of trust from some of the residents here and some of in the government and maybe some of these clinics here. Do you think this is a good effort at gaining back the trust of those residents? Is this a step in the right direction?
Well, I think this is a logical step for us to take. Many of the people who I have talked to, have a concern, where am I going to be in a year? Where am I going to be in 5 years and 10 years? And having a clinic here, backed by the hospital, I think goes a long way to answer that concern. This is a clinic that will be here. This is a clinic where people can go in right now and get a baseline if they want to, and a clinic that they can go back to as we go as we go forward. So yes, I think it's certainly something that's very valuable for the community.
This would impact a lot. Some of those concerns for long-lasting attacks, they could be able to come here to treat those as well.
I'm sorry. Say that again.
Sorry.
Yeah.
They would be able to actually come here and treat and maybe have some more questions about those long-lasting concerns that they have around them too. Right?
Yes, absolutely. I don't know if Dr. Nickel wants to add anything to that.
Absolutely. That is the plan. That's the goal.
Adding to that, can you be explicit about what kind of services as it relates to training that you're going to be offering here that maybe aren't available at the country clinic?
Doctor, you want?
Sure. Sure. The temporary clinic was to do the ACE survey and to have an initial evaluation and examination by a physician, and then to be able to triage to what was necessary. Here we can do all diagnostics, and we can do all, we can write prescriptions, we can treat. So we're going now from evaluation and triage to evaluation, treatment, and ongoing care.
Doctor, can you talk a little bit about, we've done stories in the Youngstown area, other physicians, other practices, seeing people coming from this area, complaining of the very things you folks will hear about. What are you testing for? Because we've talked to other physicians, their concern was, what do we test for when the people present with ENT issues or dermatological issues or whatever? What will you be testing people for?
We have been working closely with the Ohio Department of Health, and the Ohio Department of Health actually did put out a lot of information, including a webinar, to all of the area physicians to join on. It was very informative, and so we're following their guidelines on baseline testing, and it's also based on examination. So if you have certain findings with an examination, then you would refer appropriately based on those findings or treat based on those findings. So it's really an individualized response based on what you find on the exam.
Governor DeWine, question? So, as somebody who grew up really close to here, and I've lived here 30 years now, and who voted for you twice, this is a very positive direction to go, but it's also unfortunately very frightening that we even need this. So, what are we still doing about the main cause of people getting sick, which is our creeks? As of Good Friday and Easter, heavily contaminated. And anybody that wants to see that, I can show them. I think the EPA says now that the water is clean or safe and they've taken the aerators away. Any comments on that?
Well, the cleanup continues. I'm going to ask Director Ann Vogel to come up. Ann was here. Came in. Well, I don't know where she went.
Typical EPA.
That's not fair. That's not fair at all. The Ohio EPA was here within 2 or 3 hours after this occurred. Look, okay, I'm not going.
Why didn't they stop them from putting tracks down over contaminated soil if they were here 2 hours after?
Are you going to let me answer?
Yes.
All right. I'll take the first question. Look, the removal of the soil is continuing. There's been a tremendous amount of soil that's already been taken out. That certainly will continue. We continue to put out through our department. We continue to put out a news release at least twice a week concerning that work that is continuing. So that work will continue. The testing will continue. The testing of the water will continue. The testing of the air will continue.
And I'm not against
All right. Any members of the media have questions, please? Afterwards, we're going to go on a tour of the facility.
If you can answer this, or perhaps Dr. Vanderhoff, as Dr. Vanderhoff correctly said, starting a clinic like this takes time, takes money, underwriting. How or who is underwriting this effort so that it can be, as Dr. Vanderhoff said, for years to come? Who's paying for this?
Yes, I felt it was very important to get this set up right away. And to do that, we committed, the Ohio Department of Health, taxpayers' dollars to do this. We are also, though, looking to the railroad for reimbursement for this. So far, as we have asked them every week or every other week for reimbursement, they have been willing to do that, and they have in fact done that. But we felt we needed to move quickly. We think that, again, this is important for people in the community to have assurance that we're not leaving, we're here, and that they're going to have the medical care that they need. So we felt it was important, whether we were paid back or not, but we are certainly going to ask the railroad for that reimbursement, just as we've asked them for reimbursement for other things as well.
I have two questions. Can you walk me through the treatment process? So, somebody comes in here and says, hey, maybe I have a headache, and that's a sign from, a train derailment or something like that. Now, what kind of medication would you be giving them? Like, what would be like a treatment process? If you could just walk us through like an
Right.
example of a scenario.
It really is going to be as though any other primary care visit that you would have, knowing also that this incident occurred. So you would want to get the baseline screening that's recommended, that we've been advised by the Ohio Department of Health along with their specialist, and then you would treat that patient as you would any patient that presented with a headache, knowing that you also had this incident, so you can cover possibly additional questions such as where they were and in relation to the derailment. And if you're talking about a headache, then you certainly would also want to look into other things such as mental health, because that can affect things like headaches. So there's really not a good answer to that question, because it's very individualized based on the patient and what they present with.
Okay. And lastly, I'm talking to residents and they say, hey, I have elderly loved ones. I have people that may not be able to get to the clinic. Yes, the clinics sit in really the heart of the town, for sure, right? Somebody could easily take somebody to that, but I think them just saying, hey, there is possibly a want, there is a need here in this community for maybe even an option to have something that goes door to door. I'm not saying that's going to happen tomorrow.
Right.
But what is kind of the future potentially look like?
I think that's a great question, because what we've been saying all along is we need to see what the need is, and we are willing to adapt to whatever that need is. So if the need is telehealth, then we'll adapt to that. If the need is potentially home visits and we can fulfill that need, then that's what we'll do. So this is an evolving process. It's day one, so we're going to have to see what happens with the need.
And who is this for? Like, is the goal that people who don't just live directly in East Palestine can come here? Because obviously a bunch of surrounding neighborhoods and folks on the Pennsylvania side were impacted by this derailment. Could they potentially move permanents here?
It's a primary care clinic. Everybody is welcome.
All right, any more questions? If Governor DeWine's going to tour, you're welcome to follow. Just be respectful, please, and not push.
All right. Well, thank you very much. It's open. You're welcome to come in and take a look. Thank you.